All right, welcome everybody. Welcome to the Rehab Science Podcast. Welcome back. I'm really excited today. We've got my friend, Dr. Jeremy Bettle, who has a PhD in human performance. Super excited. We were out on a hike the other day. Really excited to get your take. I remember I was like, we should just stop talking and save this for a podcast episode. But man, so excited. We've known each other since like 2008 or 9.
Yeah, right in there. Yeah.
And I knew a little bit, I think, about your background and what you did, but just learning more about it, I'm so excited. I think there's going to be so many cool just pieces of knowledge that you bring to the table. And, you know, from working with professional athletes to the regular person, just things that people can apply in their lives when thinking about human performance. So super excited. Thanks for taking the time to come and do this. Let me just ask you first to kind of kick things off. Well, first, just tell us a little bit about your education, like your trajectory, background, who you've worked with, kind of that stuff.
Yeah. So I guess it's an unusual background for North American pro sport. So came over, I did my undergrad in the UK, and then came over to the States for a year to do my master's in 2003. And things sort of got out of control and I stayed. So met my wife the day I arrived in the States. Yeah, that was unplanned, but amazing.
Yeah.
Did my master's. They invited me to stay for my PhD, so did my PhD in human performance. From there, I knew I didn't want to be a teacher. I wanted to stay in the applied world. And so I sort of knew about coming towards the end of my coursework, I was going to have to go get a job. I didn't want to graduate with a PhD and no experience because that would make it really challenging to get a role. So went to work for USA Rugby. Got the job with USA Rugby, put the PhD on pause for a little bit, and then working with USA Rugby, met Maury out here who had the clinics, and then came out, and then that's when we met, working in post-rehab for a while. I sort of went into post-rehab thinking about my strength conditioning career, that I was just woefully unprepared that athletes are basically injured all the time, right? And so I wanted to be able to have an athlete come in, he's hurt his shoulder, but he can still work out. He just needs modifications. So I needed more formal practice in that. So I did 2 years in post-rehab and then went off to UCSB as the head strength coach. Nice. So yeah, I got to apply some of that knowledge at scale with 500 athletes and just me.
Yeah, totally. That's awesome. Yeah, it's crazy how we were working together those years. I think you were at a different clinic, so I didn't get to interact with you as much.
Yeah.
But do you feel like when you were at the clinic, were you working with people as they'd be discharged from PT?
No, actually, so the way I wanted to do it was, okay, you had surgery yesterday. What can you do today? So that's where I was interested, because if you wait until someone's already out of rehab, you've missed so much opportunity. If you've had a shoulder surgery, nothing wrong with your legs, nothing wrong with your other arm, and you've got all these neurons that feed the opposite side of the body. So why can't we be working all of these other systems, developing your fitness, developing your strength, so that when you get cleared and you can move in, now we're not starting from scratch. So as basically every day I was asking the PTs who was working with them, okay, can they do this? No. Oh, what about this? Yes. Right. And it was an interesting conversation, because working in that insurance-based model, even challenging the PT to be thinking about oh, well, I've never really thought about that. So we really built that model of, okay, day of surgery and beyond, what can we start doing? And how can we bring that through to cleared from PT? But then there's another whole phase of rehab that's from PT and medically cleared to return to performance. And so that was another part of it that we had to get really good at, because it sort of didn't really exist. And even in pro sport,
it didn't.
No, did not. And that was sort of the next part of the journey was UCSB. We were understaffed, 500 kids, open to anything. They just loved it. So, you got your 10,000 hours of practice by Wednesday morning. It's crazy.
Yeah.
Then from there went to the nets. So you go from 500 athletes to 15 athletes overnight. But because you've had that volume, you've sort of seen everything you needed to see. And you can really dive, 100 miles deep on each athlete at that point. So I was the head strength coach, director of nutrition at the nets. And then just as I was feeling the itch to sort of move on and build something else, Toronto Maple Leafs called me, and would I be interested in coming up and being the performance director for them, at least interviewing for the role. And so I interviewed and was fortunate enough to get that job, and had to build a program like a sports science division from scratch, really. So integrating medical, rehab, strength conditioning, data science, all the technology, really got quite deep into the sort of innovation side over the 5 years there, and had unbelievable success, with integrating that team and the models we built. That success caught the eye of the Ducks. They were beat up a little bit, and so went over there for a couple of years through COVID, then switched to soccer.
There's a little bit of everything.
Yeah. Went to NYCFC. We won MLS Cup with NYCFC, and then that was enough. We've traveled with the circus long enough. It's time to go back to Santa Barbara.
That's amazing.
Yeah.
It's so cool for you to have had this experience where you've worked, with the regular everyday person, and to take that into the performance world.
Yeah.
And I think you must have left Santa Barbara. We were talking about this the other day. You left right as I was coming back.
Yeah,
like that. So we just
crossed over. Yeah, exactly.
That's amazing. And it's so cool. I mean, like you said, when you're at UCSB, seeing so many people, I know this is definitely true in physical therapy, where once you need those hours, but once you've seen enough people, you start to see kind of common patterns.
Yeah, exactly.
And whether it's me kind of looking at movement patterns and injuries and pain issues, everybody's a little bit unique, but you do see kind of common patterns and common injuries. So I'd imagine similar for you, it sounds like, seeing kind of similar patterns. So let me ask you, I think, you having a PhD in human performance, that's such an interesting area. My undergrad was in health and human performance. So I think probably touched on some similar exercise physiology, biomechanics, nutrition kind of aspects. When you think about human performance, what are factors that you think are most important to think about? I mean, just imagine people who are listening to this or watching it are going to think about, okay, we all would like to enhance our performance as humans.
Right.
So what does that look like? Like, from your experience of working with just a regular average Joe kind of person, someone who's in rehab, and I love that that idea that you were working, somebody had a shoulder injury, you're working their leg or the other side. It's like this whole cross transfer effect we're talking about all the time. Like, you talk about the connection in the nervous system and how powerful it can be to work the rest of the body. And so many people don't do that. They're like completely sedentary while they're rehabbing the injury. So I love that aspect. But what are some things, if somebody were asking you, like, how could I boost my performance in all that experience, what are some things you would think, these are the priority kind of items?
Take a nap.
Yeah, no, I believe it. I like that.
It's funny. It's changed over time. But number one is sleep. Like, sleep enhances every parameter of human performance. We haven't measured anything yet that isn't improved by sleep. Everything. Every measure of health. Every measure of, like risk factors for disease. All of these things are impacted by your sleep. So it's the number one, it's sort of the first pillar that I work on with people is how do we get that habit in place? Even down to, people shouldn't be sacrificing sleep for exercise, right? Because it's not worth the trade-off. From there, your nutrition. So important. These two things, sleep and nutrition, they underpin everything else that we're going to do. So it's not that we're not working on all the other stuff concurrently, but
sort of the foundation.
The foundation has to be, like, you think about, you turn over every cell in your body, every single cell, like pretty frequently. So, maybe it's every 2 years, every single cell. So you're currently building your new self. So you're literally built out of the food you're eating. So what are we building out of? And you see that when people stick to a really good diet regimen, you change an athlete's nutrition, and then, they're sticking at it. At that 2-year mark, they look different. They're built differently.
Yeah.
And
it's like literally built a new person.
You've built a whole new person. Right. You just take your memories with you.
Yeah.
It's like remarkable.
Totally.
So I think that's such an important part of it for me, is getting those foundational elements right.
Can I dive just a little bit deeper while we're on those? What would you, so sleep, like we hear a lot of the, have a kind of routine that you follow, go to bed at the same time, try to get maybe in that 7 to 9 hour window.
Yeah.
In the athletes and people you would work with, are there other things that you would think about or coach them on?
Yeah, the sleep hygiene ones are really big. All right. So yes, a routine going into bed. The body just loves routine. So you signal your body that we're doing this sequence of events and it starts getting ready to go to sleep. And so that's the thing with, we try and go to bed and wake up within an hour every day, right? So if you can keep that consistent window, great. How many people can actually do that, right? So then there's the reality of how we coach this. In the NBA, NHL, when you're traveling, several times a week and you've got game day, practice day, off day, you've got all these different schedules. What we would do is coach a sleep routine that you just put in place 30 minutes before you go to bed, regardless of what your sleep opportunity is going to be or the time you get to bed, just to help your body recognize that there are routines in place, even though you're not at that 1 hour, go to bed and wake up time. You can still start conditioning your body that these days are the same. A home game, you're going to be in bed at 1 a.m., right? And that's going to be consistent. And then a practice day, you'll be in bed at this time for the most part. So trying to get people to sort of group the days together. So game day, practice day, travel day, each have a different routine, but each practice day is the same. Then it's, okay, what's your sleep environment? So your room needs to be cold, about 65 degrees. Your room needs to be quiet. It needs to be dark. If you can see your hand in front of your face, your body fat level over 10 years is like 10% higher or something crazy.
Whoa.
Yeah, it's nuts. It's like significantly different, So these are things that are hugely, hugely impactful. And these are the things that will wake you up. If you're too hot, you'll wake up. If there's noise, you'll wake up. Even your phone like vibrating, you won't become fully consciously aware of it, but it's enough to bring you out of deep sleep. And so it's those micro wake ups that don't allow the refreshing of your brain. Your brain contracts during sleep, and your fluid in your brain actually washes through those gaps and actually washes out like the amyloid and stuff like that. So that's where sleep is such a big risk factor in dementia, Alzheimer's, and all this sort of stuff. Which now, as we transition to longevity, it's a huge impact.
For sure. I always thought that was so cool. I remember learning about that the brain would retract.
Yeah.
Because our lymph system doesn't go into our brain. That system kind of cleans out toxins in the rest of our body. But so our brain, it's like it does that when you're sleeping.
Yeah.
Blood flow comes in and cleans out.
Yeah, exactly.
It's amazing.
Yeah.
I think those are such good. I'm glad we went into a little more nuance on this, because sometimes I think people hear like, sleep, just get 7 to 9 hours.
Yeah.
And, maybe try to make it a little cooler, make sure it's dark, things like that. But I think some of those really specific kind of strategies are so helpful. I know for me, this just kind of happens naturally because I've, having 2 kids, we are very, Kirsten and I are very on top of them going to bed at the same time each night. And it's crazy how that routine of getting them ready for bed makes me so tired.
Yes.
Like I just have to go to sleep like almost right after.
Right.
Just that wind down and kind of tucking them in. And we still, they're getting older, 4th and 7th grade. We still kind of sing to them a little bit. I'm always wondering when the 7th grader won't want to do that.
Yeah.
But that routine is really helpful. And I think I also will use like a eye mask. I've really gotten into it. Like
eye mask, earplugs, the whole deal.
Man, just blocking out any kind of light is so helpful. And I don't know if I do like to have like a noise machine. I don't know if if there's ever any research on that, but I almost feel like I've gotten a little addicted to it, because now if I don't have a noise machine, I've got an app on my phone, so I'm traveling, I can do that. But if I don't have it, I'll hear every little thing, and it does seem like it pops me out of those deeper sleep states, and I will not be rested. I won't feel rested the next day.
Same with me, because I use the earplugs. And so this is where you've got to be really careful with, people take melatonin or Ambien or something like that. And while you might not become physiologically addicted to them, psychologically, you feel like if you don't have them, you're not going to sleep. So that's where, I really caution people against using any sort of sleep aid. But that same thing, like, if I get on the road and I don't have my earplugs,
you start worrying about it.
Every noise, every little thing I'll hear. Yeah,
totally. Yeah, and you almost like you say, there's that psychological side, like, oh no, am I not going to sleep well now?
Right. Exactly.
That's awesome. Those are such good. I also having the room be cool. I started using one of the thing from 8 Sleep, the pod cover.
Right. Yeah. Amazing.
Oh man, in the last 2 years, it's probably been, not to plug or just not a sponsored thing here, but it literally has probably been the best tool I've used, because I used to wake up hot, and I'd wake up and it'd almost wake me up like if I had to go to the bathroom, and I have a hard time getting back to sleep. So just that thing keeping me cool, I sleep so much better. And so that's been a, because the room would be cool, but I feel like I just emit a lot of heat.
Yeah.
I just like, and then you're changing it at a certain part of the night, you're kind of warmer, and then a certain part you're cooler. So then you're trying to figure out your blanket situation the whole time, and that kind of wakes you up.
Yeah.
So that has been a really helpful tool. Okay, so what about from a nutrition standpoint?
Yeah.
What about, I totally hear you. I mean, in rehab, we're a lot of times thinking about, okay, you've got a tissue you're trying to heal. If you've had a physical tissue injury, macronutrients, calories, all these things, your protein intake, all these things matter for healing. When you think about that from a performance standpoint, what are some of those kind of nuanced kind of details and strategies from a nutrition standpoint that you think about in that foundation of performance?
Yeah, so like we can go all the way from that foundation all the way to very specific supplement strategies for specific rehabs, whether it's soft tissue, bone, concussion. We'd have very targeted strategies for all of those.
Totally. It's hard to. Can you just give me one answer for everything?
Yeah. So timing of nutrients, I found, to have a big impact. It's sort of strategic eating and fueling for what you're trying to achieve with your body. But I guess on a more foundational level, like ensuring that your body has enough protein. We're I think, pretty chronically under consuming on protein. Whether it doesn't matter if you're vegan or omnivore, like you just have to be hitting your targets there.
What is that? What's the one you use? Like, what's the recommendation?
So I would go around a gram per pound.
Totally, that's what I.
Yeah. So right there, and it's hard.
It's a lot of protein.
Yeah, it's a lot of protein. Yeah. So I think proteins, healthy fats. I think a really good balance of omegas, omega 3 to 6. Omega 6 is sort of villainized a lot as pro-inflammatory and all the rest of it. We should have it in about a ratio of 1 to 3 with omega 3s being more. We're actually about 20 to 1 the other way right now in our North American diet because of the proliferation of,
omega 3 kind of
sort of becoming less so because like corn's in absolutely everything, right? And so I think that it shouldn't be villainized. It's still an essential fat. But I think we've got to get it in the right levels by increasing our intake of oily fish.
We're getting too many omega-6.
Too many omega-6.
I got it. Yeah. So it's not, I get what you're saying. So there's just, in our current diet, kind of Western diet, there's a ton of omega-6. Easy to get.
Yeah. It's in everything, right? Because of the oils that are added to everything and they're cheap and easy to produce oils. So, I think really healthy fats. And then for me, the carbohydrates being the fuel source. So there's sort of the underlying sort of structural foods, and then there's sort of the fuel for both brain and muscle, and using the carbohydrates to fuel strategically, for the activities that you're going to do. If you've got a super, super high intensity day, you'll have a higher carb day. If you've got an off day, a recovery day, depending on what you've done, you might be a little lower carb. So it's a nuanced approach to it. It's not that we're on a low carb diet or a high carb diet. It's, well, what are we trying to achieve with our nutrition? So
it all comes back. I feel like it's that old statement. It comes back to it depends, right? Like it's so true. I mean, but I appreciate you saying this because, you do hear a lot of, especially in the nutrition world, right? There's a lot of fighting and conflict about different diets. And I think, it's like anything. Once you dive into it deeper, you realize how much nuance there is and how much what you recommend depends on the person's goals and what they have going on in life. So like just even hearing, because, carbohydrates, depending on the group you talk to, those are sort of,
oh man, we come to blows.
Yeah, totally. Yeah. So, and you hear people, you hear even athletes who are like full keto and like hardly, so you just hear, and I think, all of us, our biology is so unique and what certain people can tolerate, and we're talking about performance. So what things help you perform well. And I mean, like you said, carbohydrates are such an important fuel source. Yeah. And to think about, I think it always seems strange to me to hear sometimes recommendations of like no carbohydrates. And I get that some people maybe can function that way, but
some people do really well. But I think what you nailed there was the sort of individual nature of it. So like how you and I respond to those carbohydrates is going to be very different. And so, you might have the opinion that no, like carbs are awesome for you because you never gain a pound and you do all this stuff. I might experience carbs very differently, and so I think it's just a case of really meeting people where they're at. seeing how their body's responding, how they're feeling, and really tailoring, once you've sort of got that baseline.
Would you guys ever in sport use continuous glucose monitoring? Was that?
It wasn't as much a thing. I've used it personally since coming out of sport. But it wasn't as big a thing, but I would absolutely recommend using it. Yeah. I really thought it was, it gave us great metrics on how people respond and how exercise impacts you.
For sure.
Really interesting. You see these huge glucose spikes, especially if you do like a HIIT session or, an interval session, man, like you get some really, really big glucose spikes that, if you're of the mind that, these things aren't, supposed to get glucose spikes.
Totally.
Be a little alarming.
Yeah, exactly.
Oh, should I stop working out?
Yeah. No, I've seen some of the groups talking about that now, like, hey, it is normal to get a glucose spike with, because there was sort of this, and for a while, it's like, oh, never have glucose spikes.
Yeah.
I agree with you. Yeah. I've experimented with the continuous glucose monitors on a couple of different occasions, and it really is interesting just to gain the awareness of what your body's doing when you eat particular foods or work out or whatever it is. So when you're thinking about, I guess, and this is tricky. So if you had just kind of like the regular person who might be listening to this, just like has whatever, like just regular job, like aren't a pro athlete, something like that, would you say when you're thinking about some of these elements from a nutrition standpoint, would it be kind of maybe prioritizing protein first? Is that something you think about? Like try and get those grams of protein and then...
Yeah, that's how I would be tailoring it. Really making sure that we go that way. And then like using the carbs strategically. Again, not eliminating them, but being strategic. If you think about the athlete's lifestyle, like you've got games, you've got practice, you're always going pretty hard, like within 24 hours, for the most part. And so you've got to refuel, you've got to restock. For me, the way I live my life, I'm active, but it's not like going to the gym tomorrow if I'm not fully like loaded up on my glycogen, I'm really going to suffer, so I can probably live off my own stores for a while. I think I'll be all right.
No, I always think about that it's like probably when I felt the best, just for me personally, was a period of time when I was kind of on the intermittent fasting and training for a little bit, and I just would go and do fasted workouts, and man, I felt like for me, and again, I'm not a professional athlete, I'm not like having these super intense workouts for the intensity I was doing and just my own biology, it was it felt pretty good. Just like so okay, so we could spend a whole podcast on sleep and nutrition probably. So you've got those two things underpinning kind of everything. What are some other, after that, what else would you think about from a performance standpoint?
So both athletes and regular, everyday people is strength training. I think it's so critical, from a athletic performance injury prevention standpoint. Like I love the saying, strong people are harder to kill.
For sure.
And it's absolutely true. What we found in our injury prevention work with athletes is that the strong athletes had the fewest injuries, like across the board. And so we really prioritize strength. And in the 82 game schedule, you don't really have to worry about conditioning a ton because you're playing games, right? Playing and practicing. So that's your conditioning. But the strength work that we did, we just was super consistent. We were almost sort of microdosing that strength training throughout the season so we could maintain strength and power output. But anytime we were away from home for an extended run, if we were on the road for 3 weeks, that's when we might start to see some soreness and some stuff coming in because we'd been away from our full strength program. So we developed it to where we really tried to get some touches in on the strength work when we were on the road, hotels, hallways in the locker room, all this sort of stuff. So that would be next up for me.
Was it tricky with athletes in season? We were talking about load management, this idea of just like the load and stress, the volume of that, the intensity you're putting on your tissues. And you're saying kind of microdosing. Was that kind of the key? Like, was it tricky to get the strength work in there, the resistance training work, when they already were putting a lot of stress on their bodies with practice and playing games?
Yes, really tough. And, you think in professional sport, for the most part, your athletes are only allowed in the building 3 to 4 hours a day. So it's not like you have all day every day to work out with these guys. So our guys would come in, breakfast, they'd have scheduled treatments, they'd have a team lift, they'd have a video session with the coach, then we'd practice, then they'd recover, and then they'd head out after they'd had lunch. And so anything you wanted to add, what was going to move, right? It's a finite amount of time, and so you'd have to move something. So we had to find a way to get in a 20-minute window, how do we get our team lift done? And so being super efficient, making sure we hit all of the big factors for injury risk, and basically every day. So submaximal, and we're talking like a fraction of their 1 RM. You know, you think to maintain strength, you need to be up at these high levels. We'd actually hit a much lower level, but just keep things awake. And we found, you know, we'd measure on the force plate every 2 weeks. We'd measure force frame with valve and groin strength. We were able to maintain just by getting those touches every single day without having to do this huge, you know, elaborate lift where we had Olympics and we had, you know, accessory movements and this and that. You know, we could just come in and be really efficient with it.
Another one with a lot of nuance. I'm sure what exercises you're picking. You were in basketball, hockey, soccer. Like I'd imagine. I know we were talking about in hockey that you guys had I know you were paying attention to the hip adductors, the groin muscles, and you would strength test those. And you were talking about a cool kind of maybe not a specific case, but just like where you would test the strength of the groin muscles, and you'd start to notice that as strength went down in your testing, that maybe injury risk went up.
Yeah, so we our PT when we first came in, he did this extensive. Ryan Morrison, his name was, fantastic PT. He did an elaborate sort of literature review on. He basically read every article there was on groin injuries and boiled it down to a series of tests that we did for range of motion and strength. And it was super interesting that what we did was we went from sort of screening to monitoring. So rather than just everyone comes in at the start of the year, gets tested, and then we test them again at the beginning of next year, every 2 weeks we would have them on a regular cadence of testing these different measures. And we found that the sensitivity of strength testing to soreness, which was sort of our precursor to injury, basically if you came into camp in the bottom 30% for strength in your adductors, by I think about 3-4 days into camp, you were reporting some tendinopathies in your groin. You had soreness every year. Bottom 30%, like, yep, you're going to get pain. So getting that strength number up was really, really critical for us. And every time, so we'd measure every 2 weeks, and if we saw, you know, maybe it was a standard deviation drop, and that sort of sustained over a couple of tests, then you were into an intervention program. Either, you know, it was multifaceted. So you with the PT, is there anything going on? We're taking care of tissue quality, making sure you get yourself tissue work. We're looking at nerve outlets in the lumbar spine, making sure there's not a neural deficit there. You're in a specific program with the strength coach before the team lift to make sure that we're taking care of the actual physical strength there. And then even down to, if you're on the ice and you're a left winger, your normal in terms of balance of how much force you're putting through side to side might be 60-40, 70-30 on how many explosive efforts you're putting through that left groin, because you're always coming down and cutting in. So if we saw you go from 70-30 balance on the ice to 50-50, we were worried because we just got a 20% increase in load on this right groin. Gotcha. So all of these different data points going in that we could intervene with. And so it's just, we'd never pull people from hockey. What I'd always say is, you know, we're a hockey club, we're not a sports science club. So we're not going to pull you from practice. That's got to be your last thing you go to with the coach. Otherwise, you lose credibility. So we have to intervene. So it's tissue quality. It's making sure that the space to accept that extra training load. It's a really sort of multifaceted approach. And then talking to the player. You know, is there a reason that changed? Oh yeah, coach had me playing in the center today instead of on the left side. So then, okay, well, I'm not so worried about it.
Yeah, it's amazing. I think in talking to you, the systems you set up, like you and I were talking about the other day, there's often not communication between these different disciplines, and to have a model where you're kind of teaching the different practitioners how to communicate and how they work together on this sort of movement continuum is amazing. I mean, I just can't, it's such a cool approach, and to be proactive in testing things and tracking data and looking at how can we be intervening before somebody's actually got some movement dysfunction or pain. And I can think about so many situations for myself personally where a strength issue led to me developing a tendinopathy, a tendon issue, and so many patients where that's happened. I mean, during COVID, I was doing tons of trail running, I was telling you, and I ended up getting this Achilles tendinopathy. And I think, if I think back on it, I wasn't loading my calf and complex and Achilles tendon enough. You know, I was doing calf raises and things, but just not, I wasn't going to the gym because it was closed. So I wasn't doing heavy loaded. It makes you realize, and I think you and I are similar in that way with resistance training is the number one thing I'm recommending as a physical therapist. There's so much research on it now for injury risk reduction. And it's just, I feel like it's one of those things that I'm just talking to patients about. Of course, if you have a mobility deficit and you guys were screening for that and checking and we check for PT, those kind of impairments are important to address too. But it just feels like any good programs that should slowly transition to being really heavily focused on resistance training and building strength. And so cool to hear that in this kind of in the pro sports world and how you guys were measuring that and how it helped you decide what you did with your athletes. So when you were working with those athletes and you were thinking about those resistance training sessions, and I get that this would have varied by sport, but were there certain exercises or lifts that were sort of like foundational strength training exercises that you would keep in any kind of program?
Yeah, and I think this is where my philosophy probably adapted a little bit over time. I went from having like my exercises that I really love to having movement patterns. As you travel more and you're not at these beautiful practice facilities, instead now you're in a hallway. One of my favorite stories was I'm in Sacramento with the Nets, and I've got Kevin Garnett warming up for a game, and you got this guy who's like, fifth most all-time minutes in the NBA, and you're thinking, man, I'm going to be working with the best in the best facilities all the time. And instead I've got Kev working out doing lunges with like a 50 and a 30-pound dumbbell, and he's like in front of the urinals in the bathroom because it's the only place that we've got a space, and you're like, this is not what I thought pro sport was going to be like, Oh yeah, it's really fascinating to be able to sort of apply that. I think I've lost my train of thought.
Just like, were there exercises like, because you hear about like movement patterns, you're saying,
movement patterns.
Like everybody talk, we've got squat, hinge, lunge,
and you've got to do, so you got your Olympic guys. Well, okay, now you've got a 35-pound dumbbell in the urinals. Like, now what are you going to do? Right? So you just, I look at the sport, what's our predominant movement pattern? What's the biomechanics of our sport? And let's do a movement pattern that looks like that, right? So hockey, we did a lot of lateral lunging, a lot of lateral movement, just to make sure, because, you think about injuries, and you basically get injured when you exceed capacity, right? But capacity is a sort of a nebulous term, and I see it as endurance, strength, power, range of motion, velocity, all of these directional elements and all of these different muscle fiber characteristics. So it's the direction we're moving and the speed that we're going to do that in and the ranges of motion we're going to go into really are the indicators of that sport's injury risk. So we would try and replicate a lot of those and make sure that we were getting people in the velocities we were going to be moving at, and also in those big ranges of motion. So athletes going vertically, in basketball, hockey players only go laterally for basically every movement, soccer players front to back. And so like the Nordic hamstring was really important for them. The Copenhagen plank was really important for the hockey players. One of my biggest injury prevention exercises for the NBA, every warm-up started with jump rope. Just to get that Achilles tendon, again, it's just the stretch reflex. And that's where your tendinopathy comes from. Do all the calf raises you want. You suddenly go to trail running and all of a sudden it's loading, right? And it's the stretch shorten cycle speeds up. Now that you're starting to get flared up.
For sure. Yeah, I love it. I just love, because you're right. You hear this term capacity, you're speaking my language. Like, this is all we're talking about PT now. Like, you've got a injury happens, pain can happen when you move beyond that capacity of your tissue, but it is sort of a nebulous term.
Yeah.
And I think I like the way you put it, where you're looking at how much force can you produce, what kind of endurance do you have in those muscles, the power output, the range of motion you're moving through, the directions you're moving. And sometimes it can get so complicated, but I think you're right. If you just look at, what are the movement patterns that you engage in or activities you engage in your life, and just try to come up with exercises that train those movement patterns.
Yeah.
And just like you said, I've actually run into, I remember seeing in the tendinopathy research, this kind of stepwise protocol you'd go through. And, high load resistance training is kind of towards the lower kind of middle end of that program, but you do have to get to the stretch shortening cycle, the more explosive kind of powerful movements. I would have so many patients where maybe they have tennis elbow and they're doing all the slow isometrics, eccentrics, all that stuff for their wrist extensors, but then they just go right back to tennis again.
Yeah, look at the gap, right, in what happened there. And that's that late stage rehab we were talking about. So being able to measure that and like this is where the load management stuff comes in now. So how do we progress you safely from, okay, I've done my wrist extensor exercises. How do we know when you're ready to go to something more explosive, and what does that exercise look like? How do we know when you're ready to start tennis? How do we know how much you should progress in tennis before you go and play a game? How many games should you play in a weekend before you can get to a full tournament? So all of these factors are what we have to build in on how do we go from step to step. And that's where our measurement, the objective data, came in so handy. What we put in these rehab protocols, that every progression was measured. Because, if you think about, like, what's the first thing you're cleared to do, basically, in an ACL protocol by your doc? Cleared to run.
Yeah, exactly.
Like, no gym, no plyos until you've done this. Like, plyos, dangerous. Cleared to run. Well, running is 1 million single leg plyometrics, right? How many reps do you have? And that whole chain getting impacted, like with every step you take, you think, okay, well, if we run, what's the times body weight going through the ground? The reaction forces could be up at 6 times body weight, 1 million times on one leg, right? So do you think we should do some plyos before we get to that, right? So we got to make that look more like a curve than a step-by-step approach, where it's like, well, let's progress them, and if they flare up, we'll back them off. Well, why wouldn't we do the back them off step a little bit before we go to the big step? And why don't we measure? We know what the ground reaction forces are. We know what the volume's going to be. We can measure, are they ready to do that? And if they pass that test, then they can go on. And then we don't have this yo-yo of rehab, right? Where an athlete's flared up and this and that and the other.
Totally.
And then in the late stage, we get to worry about, okay, well, they've been out for an ACL. How's the Achilles doing? If this is a basketball player, they're going to have to land from a vertical jump with 10 times body weight. Now we don't want that to turn into an Achilles injury, right? Or the groin injury to turn into a hip injury for, or a back injury for a hockey player. So it's now before you actually go on, are you ready for the demands of the sport? What other injury risk factors have you picked up along the way based on the demands of what you're going to do?
I love that. I mean, I love the idea because you're right. So often it's, let's just jump to here and test it.
Yeah.
And then if you get flared up, we'll back off again.
Yeah.
So what would you guys do if you're looking, and is this, I remember you sent me this kind of optimal, kind of this spectrum, optimal performance spectrum. Is that what you were referring to?
Yeah, exactly. Yeah.
So how would you decide, or what kind of tests would you do? Say you had that ACL, athlete had the ACL reconstruction. Say they're doing all their slow strength, they're doing like their quad, their leg extension, they're doing all this slow squat strengthening. But then, the surgeon's like, okay, you're cleared to run.
Yeah.
What would you test to decide? Because I totally agree with you, like having some plyos, because running is such a plyometric thing.
Yeah.
What would you be starting to integrate there, and what would you be testing to decide, are they ready for this?
So I would look at, there's a number of things. So, I mean, going way back, we're looking at, is your squat normal, right? And then, okay, you're good for the next level. Now, is your counter movement jump normal, right? So now, and we're looking at both mechanics and ground reaction forces.
On a force plate.
On a force plate, yeah, exactly. And it might just be your iPhone, all right? It doesn't have to be these elaborate systems. Like they've boiled those down into your cell phone now with pretty good accuracy. So we can measure that. Then we start looking at depth jumping, right? So 2 legs, step off a box, down and up and land again. And looking at mechanics, ground contact times, and then doing that single leg. And what we can really see there is the difference in eccentric loading leg to leg. You can see as they try to load, they'll avoid the knee, right?
They'll have a stiffer.
It'll be very hip dominant.
Got it.
Right? They'll get depth, and they might get off the ground quick, but it's from the hip and not the knee. And so that's where the mechanics come quite in. And that stiffness in the knee is itself a risk factor for a re-injury of the ACL. But it's also, if you're just thinking about straight line running, it's just going to get sore because you've got nothing absorbing the shock outside of your joints, right? If you've got good eccentric loading, you can get that good compression, that good absorption throughout the chain. But on that side, you're going to have that awkward sort of like hitch in your stride, and that's where you're going to get inflammation. You're going to get sore. So we would, certainly with soccer players coming back from knee injury, that would be a key metric for us before they were able to turn to run. Would be what's the reactive strength index on a single leg depth jump.
Yeah, it's like you said. I mean, this is where biomechanics comes in and is so important. It's like you're boiling down. You're looking at a movement pattern. Mm-hmm. And then you're breaking it down into these individual parts and kind of observing and testing and training each of those parts before you go to a global movement like running.
Yeah.
Because it makes so much sense. You've got your ankle joint to worry about. You've got the knee to think about. You've got the hip. How are they compensating around this? We know of these common compensation patterns in like a ACL reconstruction, for example, and to go through and make sure you're training each of those. The eccentric knee flexion. Can they accept load when they're bending their knee? Are they willing to do that, not just use their hip and all the issues that can come if you just say, okay, just go run and jump back into it. It makes a lot of sense. That you sent me this slide the other day, this continuum that kind of showed the steps you guys would work on. And I think it must have been somebody maybe who was injured in the whole process they'd go through.
Yeah, so it was my demonstration of what a department looks like by skill set. So rather than having an org chart, we would have basically a graph of intensity going up this side, and skill set going along the bottom. So what was the intensity at which you work with the athletes? Are you a manual therapist working at a joint level, just on table, very low intensity? Or are you the head coach coaching in overtime of MLS Cup final? Right? The intensities are very different. But in between that, you've got your soft tissue therapist, and you've got your corrective exercise, your strength coach, your plyometrics, your practice, your games, postseason games, and then worst case scenario games, right? And so we have to touch every point along that spectrum of intensity with everybody in the department having a role. Nobody's ever at zero, right? But we all play a role at a different point in that. And if you miss one of those steps on the intensity spectrum, it's too big a jump to the next one. Like in rehab, we can't go from correctives to plyos. Right, you've got to prepare for the forces that are going to come here. Once you've got the forces, you can add the speed, right? But to have the forces, you've got to have the stability. Mm-hmm. Any one of these, it's too big a jump if you skip one. We can't go right from, practice to, okay, you're in overtime of the MLS Cup final. You're either going to perform badly or get hurt. And so that's how we look at preparing for those is okay, the demands here are known. And so we have to prepare you for that. Load management has become about rest. It's not. Load management is how much can we give you to prepare you for this. It's how do we manage your load to withstand the demands of your sport, right? Or the activity that you and I want to do. You want to go trail running? Great. But let's assess the demands of that, right? It's going to be really hard on your Achilles. You might want to do some jump rope.
Yeah, I love that. Because you're right. Load management is a new phrase for a lot of people. I mean, I think in the rehab and in the strength and conditioning world, we're hearing it. We're more familiar with it. But to patients and regular people, like, what the heck does that mean?
Right.
And unfortunately, all too often, I think the recommendation, especially from maybe a physician or a medical provider, when they're talking about load management, even though they're probably not using those terms, it is just rest.
Yeah.
And we know there's so many conditions, right, that you're not building tissue capacity when you're resting, and rest can have its place maybe right away in a few days when you're really acute from an injury or something, but you do have to start building the capacity of that tissue again. And I love the way that you broke it down, because I think, physical therapists and strength coaches, this has been kind of a conversation for years now of, hey, there's this kind of human performance continuum, movement continuum, and the physical therapists are kind of on the, they're on the side where the person has more issues with their movement. They've got pain and they're injured. And oftentimes people will go to physical therapy, their insurance ends, and it's like, well, if you just drop off right there, you've only built your tissue capacity to a certain point. It's probably not a point where you're ready for more forceful activities in life. And so there was this kind of coming together, I think, in a lot of places where physical therapists and strength and conditioning coaches were working together and helping to kind of maximize that person's capacity. So I think it's so cool, just these steps that you kind of integrated and built in there. Are those, now you're out of sport, right? You haven't designed these, you're not running like you're a performance director managing all these people. You're out seeing regular people now and working with them. How much does this conversation come up with the everyday person?
For me, it's everybody with a human body. The great thing is, like, and I'm now moving that model into basically the longevity space. Because if we take care of these issues, my job was to get people performing like at their absolute peak in 2 days' time. That's how we should look at longevity, right? My company's called Vitality Collective because longevity is this weird thing that's in the future that we can take care of later. Vitality's today. Right? How do we feel? Right? Like, do you have pain? You shouldn't. Right? Just because we get into 40s, 50s, 60s, doesn't mean you have to just be on this descent into oblivion. Today we should feel great. And so we need to look at that spectrum. Why do you have pain? Right? It's tissue capacity, and are you sitting too much and your back's hurting? Right? So what's your capacity that you're building up there? And who needs to be involved? Right. And so it's that same checklist. We need to work at the joint level, tissue level, and work you all the way up, because it's the activities that you love that keep you vital. Right. For me, it's not going to the gym. Right. I don't just love that. It was playing rugby. Now it's hiking and paddleboarding and all these different things. If I can do that, I'm happy. We just accept that we're going to have to stop doing those things. And for me, applying this model now into that vitality space, the longevity space, if we feel great today, we can keep doing that. We don't get this decline in VO2 max, in muscle strength, and all of these factors that are so key in longevity. We're not going to medicate our way to longevity. If we lose quad strength and we can't get out of a chair, like, that's it. Right, we're done. No amount of NAD infusions, none of this anti-aging like supplements is going to help that. So we've got to keep people active. Well, and we do that by that same process. Strength training, plyometrics are crucial for fall prevention. Right? How fast can you get your leg out from under you and eccentrically decelerate your body weight? So we're keeping people in plyometrics. I've got 70, 80-year-olds doing plyometrics because they need to maintain that capacity. A lot of these things aren't capacities we can get back if we lose them once we get into our 70s and up. So taking them now and keeping them to go all the way through, I think that's where it's critical.
Yeah, that's so cool. I mean, I love that you're talking about this because you're right. I think so often, whether maybe it's from media, friends and family, other healthcare providers, people do sort of get to this point where they just accept that there's just going to be a decline that happens with getting older. And I think, of course, like, things change as you get older, but I think sometimes people maybe accept more decline than they should be, and if you were to implement, the strength work, the power work, like you're talking about, the plyometrics, not a lot of older people think about jumping and plyometric type exercises. I mean, but you hear that, right, in the research, that if you implement those kind of exercises, older individuals are less likely to have severe injuries.
Correct.
If they do trip, they can catch themselves, because you've got to be able to generate that force rapidly. But I think as somebody maybe in your 70s or 80s, you can't, it might feel abnormal or strange to be doing these kind of explosive.
Yeah, but you think of them as like, you got to be an NBA player. Right? Oh, I got to be able to jump on that 60-inch box over there. It's performance for you, right? It's at whatever level you're going to go out and perform, that's where we need your capacity to be, right? If you look at the studies on like even hip flexor volume, people who fall and break their hips, they found had 50% less hip flexor volume. So your strength to be able to lift your leg and get it out from under you, right? Just that volume measure of your hip flexor is just critical. So just the level of what those plyometrics need to look like, it doesn't have to be these super explosive. You're not dunking a basketball, but you better be able to catch your body weight if you trip. Because nobody's just standing there and falls over. Right? Like the traditional balance stuff that we work on, it's like, that's not how that happens, right? You catch your toe on the rug, right? And so can you move quick enough, brain to body, to be able to catch that?
I had a patient who I think she was rehabbing from a total knee replacement, so we hadn't really gotten to any power work yet, but we were doing resistance training, strengthening work for her lower body, for her quads and things. But she went on a trip, and she was on a vacation, and she caught her toe on an uneven surface just outside walking, caught on the sidewalk, and she was able to get her leg out there, but she said it was just like slow motion. She slowly just fell.
Yeah.
And luckily she didn't break her hip or anything really, but she hit her face on the ground.
Yeah.
Broke her nose, broke her cheekbone. Yeah. I mean, it was like one of those stories where I had been thinking about power development with older individuals, and this research was kind of coming out on fall risk.
Yeah.
And that's, her case just sticks with me so much on, it's important to work on resistance training and strength training, but you've also got to be thinking about kind of that velocity, acceleration.
Yeah, that rate of force development, right?
Big time. Not just for the young athlete, but for people all throughout life.
Yeah. Well, so it's why guys like us, like, going into our 40s, it's why we're the biggest demographic of tearing our Achilles, right? Because we stopped doing the activities that we've been doing, but our mind doesn't know that yet. Right? We're like rock stars, right? So we can still go out and play basketball at lunchtime. And slowly over time, you do less and less and less explosive stuff, right? We jump less, we think about it less, and then we go play basketball, land with all that body weight, and gone. There it goes, right? So, yeah.
Yeah, that's one I've for sure worried more about, and implemented strategies to protect myself against the Achilles ruptures. Because, man, I can't tell you how many friends I have that work at desk jobs. Just like you said, they still imagine they can do these things. They've become deconditioned. They've gained a little bit of weight, and then they go play a pickup game of basketball. And I'm just turned to sprint back to the dressing.
Exactly.
Heard this pop.
Just took a step. Yeah.
There it goes.
Yeah.
And that was one, I think, during COVID, I woke up to this a lot because I wasn't going to the gym. And every time I'd go to the gym, I'd have my kind of normal strengthening work I do, but I'd always have plyo built in. I was a gymnast in martial arts in high school, and I always liked jumping. I've always liked jumping, but I realized I wasn't doing much jumping.
Right.
And it occurred to me all of a sudden I was starting to get patellar tendinopathy and Achilles tendinopathy. I had implemented just a little bit of jumping, but and then when I started developing this, I was like, oh, wow, it'd probably been several months I hadn't been jumping. I just didn't even think about it because it wasn't in my normal training environment. Just my habits had changed, your routine, and it made me realize just how important it is to have some of those types of exercises, especially as you age, built into your program.
Yeah.
I just saw somebody online the other day talking about their Achilles tendon rehab, and this whole progression we're talking about here, but he was saying, my Achilles was getting better. I was doing kind of all the strengthening, but it wasn't until I started incorporating jump rope that it really helped it, and it got all the way better. And it made me realize just how important that kind of more explosive stretch shortening cycle, that has to be a phase of rehab. And I think, again, in my space in PT, a lot of people will get to the resistance, the slow strength, but they won't be moved on. They'll be discharged, or the practitioner just isn't trained in that.
Yeah.
And you need these other steps to get back to.
It's scary, right? Because we're always taught those are the high risk movements. So we're always like, well, just don't hurt them. And so we stop there, actually increasing their risk of an injury going forward. And it's interesting because, like, even down to selection of your surgery type, we're conservatively managing Achilles ruptures now because the data's out there that you get your strength back. Like, strength will be equal, but you will never get your power back, right? And so that's a metric that's missing. So if we're talking with athletes and we're talking with people who want to go back to a high level of activity, even the kind of intervention that we sort of go through with that Achilles is really important to know what our outcomes are going to be.
Wow. So that's interesting because I had seen all this cool research now on conservative management of Achilles tears healing. And I was just looking at I want to say it was a big systematic review that was comparing non-surgical to surgical and outcomes.
Yeah.
But I didn't know that power aspect. So are you saying the people who went conservative and didn't have surgery, they were not able to get the same power back?
Never comes back.
Wow.
Yeah.
So they can give you
it's just longer,
right?
Your Achilles is longer.
You lost
or lag in it, right? And so even when we repair them, we want them repaired short and get the length back versus, if you repair it just a little bit too long, you've just got too much give in that elastic band.
So for explosive power athletes, really the recommendation is to have surgery.
Yeah.
That's awesome. I did not realize that part of it. I thought I was like, this is so cool that these are healing, but I was like,
yeah, that's mind-blowing in itself.
Yeah, totally. Yeah. The fact that it's even, I mean, even with ACL, some of these studies now, there's some certain people that are healing and they're redoing imaging and it's healed. I mean, and I think still at this point, kind of trying to figure out who those people are and what happens there. But so you're focused on with the longevity, getting back to the longevity.
Yeah.
I mean, I think it's cool that you're focused on that now because, there is a lot going on in the longevity and kind of health span space right now, which I think is cool. Maybe another consequence of COVID of people sort of reprioritizing their health.
Yeah.
But it is tricky because it is something that's so far out there.
Yeah.
And you read a lot of, there's books and things out there talking about different things to implement. But I think sometimes it can be information that people read and they know, but they don't always, it's harder to make changes and know what you should implement day to day.
Yeah.
And I think it's cool. It sounds like the work you're doing with people is a lot of coaching them through what can you be doing on a daily basis to promote vitality, which will turn into that longevity.
Will turn into longevity. Yeah. So we're taking it from being some future thing that we'll deal with later to right now, but it's change management, right? We have to get people to change their behaviors. So it's not a fast game. It's letting the client sort of lead on the change. It's seeing their readiness for change, the family's readiness for change, because your environment's so critical in changing habits. So really making sure that there's a whole system supporting them through this change. Building sleep habits, building good technology habits, building good nutritional habits. These are things like the exercise bit's almost the easy part, because you can show up and train with me at the gym, right? And I'll keep you there and keep you accountable. But what are you doing in the 23 hours of the day that I'm not with you? So it's really coaching them to become self-sufficient in those areas. And those can be some of the biggest challenges.
For sure. Yeah, this is another one. Again, I keep bringing with rehab, adherence is always the tricky part, getting that behavior change. And just like you said, what happens in that session when they're with you, that's easier to control.
Yeah.
But what are they doing when they're outside and how can you help people with adherence? I remember hearing this talk from Precision Nutrition at one point talking about they would rank things on a 0 to 10.
Yes.
Do you remember? Yeah.
Yeah.
It was the first thing they would do is can you take a multivitamin every day?
Yeah.
And if people, 10 out of 10 was, I can definitely do it.
Yeah.
And it was anything below an 8 or 9 out of 10,
8 or 9,
they wouldn't implement it.
We're not doing it.
So it was multivitamin, most people are 10 out of 10, I can take a multivitamin every day. So it is, I definitely find in rehab, and I think we're probably similar in a lot of ways with this, that is sometimes the most challenging part is figuring out how can you get people to integrate these things, because behavior change is so important.
Yeah.
It's you can't just, in physical therapy, it's you've got the therapeutic exercise component of things, but sometimes the behavior change is more important because that might be the thing that's flaring them up or increasing injury risk. And if you aren't going to change that, you're not going to go very far. And so will you, when you're thinking about that with people with their environment, kind of their social setup, encouraging success, is this just kind of a discussion you're having with them, making them aware of you've got to be thinking about all these other factors to be successful with this goal you're going toward?
It's actually coaching them through all those parts. So yes, awareness is first, but we might have interviews with family members. Okay, so the client filled out the forms. You might also have their daughter fill out the forms for them. What do you wish that your dad would do differently? So you've got a bit of accountability, and then you're talking to the daughter. Would you be willing to make these changes with your dad to support it?
Wow,
right? So now we're starting to integrate into the family system, right? And the more people you can have on board, knowing what the change is going to be, supporting the change, I think the better perspectives we get. And then that just supports with the whole sort of mental health and well-being side of things as well, of the family's all out doing this, and, I don't want to be, so you've got now a community around it. So now everybody's doing it as a community and doing it together. So it's supporting people through all of those changes, going into their environment, looking at how the environment is shaping their decision making. That's what we would do with the pro sports teams facilities. We go in and redesign the facility based on basic behavioral economics, and that the whole nudge theory. That there was a Nobel Prize won there, right? That if we just laid things out in a certain way, it would guide the players' behavior there. If they come in and we want them to eat a certain thing and the chef's already prepared it, they'll come in and they'll eat it. If you just give them an array of different foods, they'll choose the ones they like. If you change the order and you put the salad first, they'll eat more salad, right? So it's how we design their environment, how we guide them through their day, to have some of the system just happen to them. That can facilitate the change where, for me, for example, if I can't see it, it does not exist, right? If I have the vitamin I'm supposed to take on the counter, I'll take it. If it's in the drawer, we'll not take it. Because I don't think about it. So even just understanding how the person's mind operates, how they make change, how they accept, these things into their life, it's challenging, but you've sort of got to be guided by someone who's already flipped over all the rocks of what's important and what's not, because there's so much out there to do.
Oh yeah. If you're trying to take this on by yourself,
yeah.
I mean, you realize listening to you talk, this is why you have a coach.
Yeah.
You need someone who's had that experience and knows what things to focus on, because you get overwhelmed by all this information.
I mean, I do.
Yeah.
I studied it for a while, right? So you've got to have someone that can help you make these decisions, then really focus on stuff that's meaningful.
I love that idea of laying your environment out, just with all these different factors we've talked about that go into performance, because again, we'll think about it, maybe we've got someone, we want them to do a hip flexor exercise at home or something. It's like, well, if you put the band out and you can see it, you walk by it and it's there, it's by your toothbrush, or you're maybe more willing to do that exercise, and you kind of try to build in. But thinking about all these other elements of health and how you could, and what you guys were doing with the athlete, man, I just need a chef to show up at my house.
Yeah, exactly. Right. Yeah. So just do that.
Just make what I need each day. But
you know what? A lot of this idea came. Our equipment guys at the Leafs were absolute genius. In most locker rooms, there's a big trash can in the middle, right? And so everyone's taking off their tape and throwing in, or towels the same, right? These guys had put a trash can at the side of everybody's stall, just a little trash can. That place was the tidiest locker room I've ever been in, because guys would just take the tape off and put it in their trash can. Take their coffee cup, put it in their trash can, right? So now, instead of there just being tape all over from guys that are trying to throw it into the middle, it was genius.
Wow, right? Such a small change.
Just little changes. And so that's what sort of got me thinking about this whole environmental design piece. It's wow, if we just think about the layout and how guys flow, it's basically what I wanted was we dropped them in a river as they got out of their car and they just flowed through the system.
That's awesome. And you can totally do that at home.
Of course.
You just think about in your own life, how do you set it up so that each day those things that are health behaviors you want to change, how do you make sure you're going to come across
just
those?
Put them in your face.
Totally.
Yeah.
And to bring family on.
Yeah.
Asking them about the goals and bringing that. I mean, because so many times it's an isolated solo kind of thing that someone's working on, and to bring their social support system in and have some accountability at home too, besides them just working with you. That's such a neat idea.
Yeah.
Well, dude, Jez, I feel like we could talk about this for a lot to do a number two at some point. Can you, where could people find more about what you're doing?
Yeah. So, Instagram, I'm doing bits and pieces on there. vitalitycollective.health. That's website as well, vitalitycollective.health. So yeah, we'll have blogs and newsletters and all sorts of stuff going.
Heck yeah, man. Well, thanks for coming on.
All right.
Awesome.
Yeah, thank you.
Yeah, do a number two at some point.
Yeah.
All right. Thanks, dude.
Thanks, mate.